Hi, my name is Kirk Hamilton, your host of the Staying Healthy Today show. This is a show where we bring you key experts in the fields of nutrition, prevention, integrative, and lifestyle medicine. Today's show topic is the key to prostate cancer. It's an interview I did yesterday with Dr. Mark Schultz in his office in Marina del Rey, California, who is a medical director of prostate oncology specialist in Marina del Rey, California. And that's a group of physicians, oncologists, cancer specialists who only treat prostate cancer. And the reason I send patients down there is because, you might say, why? It's because I've never had anybody not come back and thank me. And number two is I know when patients go down there that they're going to get the most up-to-date treatment for their prostate cancer, and their intention there is to preserve the quality of life and the physical nature of those individuals with prostate cancer. And then also, when the cancer is treated appropriately or when it's under appropriate treatment, to really deal with the real potential risk factors for death in those individuals, which is not prostate cancer. Because many people do very, very well with prostate cancer treatment, and they live long lives, and they die of heart disease or another cancer or diabetes or Alzheimer's or something like that. So I have great respect for Dr. Schultz. He came up with a new book called The Key to Prostate Cancer. He interviews 30 experts. And the goal of this book was for the patient to be able to collect their laboratory tests, their scans, their other data that they get from the workup of their prostate cancer, and be able to categorize themselves, and then in that category find out what treatments are available so they could be more focused and not worry about the vastness of prostate cancer, because there's many variations. And so they came up with an acronym. So for breast cancer, it's the color pink. Well, for prostate cancer, it's the color blue. So they came up with 5 shades of blue, and it's in the acronym STAIR, S-T-A-I-R. So that's sky blue, that's teal, that's azure, that's indigo, and that's royal blue. And each one of those categories has different characteristics of cancer and different treatment approaches. And so that's to help the patient just make the vast world of prostate cancer simpler. So some just generalities that I always like to get out with and share with people is that prostate cancer, number one, is you don't have to make a rapid decision on treatment. You have time. It is generally a slow-growing cancer, so you don't rush into therapy in 1 or 2 weeks, especially if someone says surgery. In fact, surgery is old school. It's more robotic now. It looks better, but the truth is it's not hardly ever necessary, if at all. In fact, Dr. Schultz doesn't believe it is necessary for almost all prostate cancers. So if somebody says surgery, because there's risk factors that go with post-surgical life, get a second opinion prostate oncology specialist. So the incidence of prostate cancer is probably, it's hard to say because people are getting older and living longer, and there's going to be more prostate cancer. People are going to live with it longer. They're going to die of heart disease or diabetes or something else. In fact, most do, than the prostate cancers. And then we have better detection techniques. 3D MRI is the new kid on the block, and it's a really great way to diagnose prostate cancer, probably better than a biopsy. So we probably have that, more frequency, but it's hard to say if the frequency is actually increased. So screening can be with the PSA, and it still should be. It's a standard, and high-risk people start at 40, otherwise start at 50, and you want to watch for the rise in the PSA. And then if you have a high PSA, it doesn't necessarily mean you have cancer. You want to have a color Doppler ultrasound of your prostate or a 3D MRI of your prostate, because if you have a big, like benign prostatic hypertrophy and a big volume of your prostate, then you're going to have a higher PSA level. It doesn't mean cancer. So for example, if you had 100 cc prostate, a big prostate, you divide by 10, and that PSA expected would be 10, and that doesn't mean you have prostate cancer. So it's always good to get the 3D MRI or the color Doppler ultrasound by skilled people like those at prostate oncology specialists, and find out the volume of your prostate. Then you can have a correspondent PSA level. PSA levels are very important for when you have treatment, to follow the progression of treatment and when you cure the disease. So that's important. The diagnosis, biopsies. Okay. Number one is Dr. Schultz feels strongly that biopsies do not spread cancer. There's been millions of biopsies, and there would be a higher increase of the incidences of prostate cancer if it was spreading cancer. But here's how you get a good biopsy. And I remember in the last interview a couple years ago, I did this same talk, but it's really important. You should not have a shotgun 12-core biopsy. That is not correct. And many men in the past had those, and they just, would swear at you, I'll never have another biopsy. What your biopsy should be guided by either a 3D MRI or skilled people with color Doppler ultrasound. And when it's guided, you're going to go straight to the area that looks like there's a problem, or you see the cancer, and you're going to get 1, 2, maybe 3 or 4 biopsy samples, not 12. So anybody, and you should ask this to the radiologist, whoever's going to do the biopsy beforehand, how many samples do you think you're going to take? And they should know. And it shouldn't be 12. If someone says 12 and they're doing the 3D MRI, they're just practicing or something. They're getting their data up. So between 2 and 4 is where you should be, and that should be guided. Many prostate cancers can be just watched. They're called active surveillance or watchful waiting. That is actually an accepted traditional, quote, treatment or medical approach to prostate cancer. In that realm, when people get treated for prostate cancer, either watchful waiting, you really need to look at the chronic disease risk factors, because these people will die not of prostate cancer. Many people, most will die of heart disease or diabetes or Alzheimer's disease, those kinds of conditions, or colon cancer, some other kind of cancer. So you have to, once you get the treatment going and people stabilize on some type of approach, they may still have prostate cancer or could be cured, but you need to look at what really kills people in men, and that is heart disease and other cancers. So prostate cancer is unique in that you can have it, and it can have wide ranges for a lot of people, but it's not going to kill them, okay? So that's very important. Lifestyle and prostate cancer, you want to get thinner. You want to do, one of the things that Dr. Schultz is very adamant about is physical strength training, especially when you've been on hormone deprivation therapy, blockade therapy. Men don't feel as strong, and the exercise and the weight training really, really helps, like 3 times a week. So that's good for anybody in my world, but that's especially important for a prostate cancer patient. Diet, for those who can do it, a strict plant-based diet has been used by Dr. Dean Ornish, and it can help reduce PSA levels. It's been shown to improve immune function and reduce the need for further treatment in people that have low-risk prostate cancer. So definitely whole food, more plants is the way to go, and that is very, very important for prostate cancer. So my suggestion is, if you listen to this interview, you're going to get a lot of pearls. And remember, don't go into treatment quickly. Get a second opinion, i.e., I like prostate oncology specialists. Don't get a biopsy unless you know it's going to be guided. And really, really can reconsider if someone says surgery right away. There are other options that can medically treat your prostate cancer. So the whole goal of this book is to make life easier for the person that has prostate cancer and their family, to pick out the appropriate therapies, and also to reduce unwanted treatment. Prostate cancer is a multi-billion-dollar industry, and you don't want to just walk into treatment to be treated. You want to know what you're doing, and it wants to be the least amount that you need. So prostate cancer is not something to be feared. It's something that I think really that we're conquering, and I think that the leaders in the field, at least I'm very honored to know prostate oncology specialist group of Jeffrey Turner and Richard Lamb and Dr. Mark Schultz and the others that work there, because they've really helped me out in feeling good about my patients getting taken care of. So you can get the book, The Key to Prostate Cancer, by going to the website prostateoncology.com. The link will be in the YouTube and description below, and you can call prostate oncology specialists or go online, prostateoncology.com, and you can self-refer yourself. And I would highly recommend that, if not a primary, as for your primary doctor to treat it, or a second opinion. Okay, don't rush into a treatment for prostate cancer, especially if it's going to be a lot of invasiveness and you don't feel comfortable about it. Get a second opinion. My name is Kirk Hamilton. This is Staying Healthy Today Show. I'll talk to you soon. You have a fabulous, fabulous day. And look below this link for the link to the podcast.